Did you know that St. Luke's University Health Network, based in the Lehigh Valley, Pennsylvania, has been recognized by the U.S. government as the highest performing health system in the United States for quality? You heard right. St. Luke's #1 recognition affirms our status as the top leader among the most respected healthcare providers in the nation, including Houston Methodist and the Mayo Clinic. To state it simply, if you want to receive the best care when you go to a hospital, come to St. Luke's.
Listen, all you New Yorkers. Taxi. Okay, man, we're looking around.
This is the 77 WABC minicast.
Progress in cancer. Well, we've all suffered. For friends, relatives of cancer, with us today is Dr. Luis Diaz from the Memorial Sloan Kettering Cancer Center. And Dr. Diaz, as I said to you when we talked previously, my mom passed away in 1977, April 3rd. And 50 years later, I would hope we made more progress in cancer because, and I don't know, but you're the expert. You help run Memorial Sloan Kettering, the world famous, and people go from the whole world. They come to Memorial Sloan Kettering hoping to get a better solution from you guys. And give us an update.
You know, happy to do so, and thank you for having me. Cancer is such a scary word, and when I started my training about 25 years ago, I can tell you that we didn't have the same tools and the same therapies that we have now to treat cancer. We were diagnosing it too late. The therapies we had were not as effective, and the side effects were terrible. We now have tools to detect cancer early so that it can be treated with minimal surgery, minimal therapy, minimal radiation. And even in the advanced diseases, we have therapies now that can either cure certain subsets of patients or even lengthen survival from a few months to many years.
Now, is there any, I hate the word to use cure. Do you think that someday there may be a cure, or do you think that our own body could cure things if our immune system worked better? And give us a comparison between medicine and immune systems in our bodies.
Yeah, so I think that the dream is, and I do think that we can use the word cure. The dream is that, A, we either prevent the cancer from happening, in the same way that we prevent or control heart disease, or treat it in the same way that we treat an infection with antibiotics and just make it go away. And there's a growing list of cancers, because not all cancers are the same. We can't say we're going to cure cancer. We can cure individual subsets of cancers. But there's a growing list where we have therapies that can melt the cancer away, that can make the cancers disappear, or that can control them over a large period of time. And that's different than a few years ago, 5, 10, 15 years ago. We weren't thinking that way. But part of it is that the immune system, and we can control the immune system better, because a lot of the research we've been doing has really taught us a lot. We can control it in such a way that in certain cases we can make the cancers either get controlled for a long period of time, or even in some cases get cured. And we have to say, what does cure mean? The cure means that you're in remission for 5 years or more. And those numbers are increasing.
The #1 cancer that people think it's a death sentence, I guess, is pancreatic, is it?
Yeah, pancreatic cancer. But the #1 killer in the United States is still lung cancer. But that cancer, those numbers are going down because of smoking cessation and just more understanding on how to screen for it. So if you are a smoker, you're going to want to get screened by a CT scan on a regular basis. But following that's colon cancer, which you want to be screened by colonoscopy. But you're absolutely right. We don't have a screening test for pancreatic cancer. And if you get diagnosed with pancreatic cancer, it's a really tough tumor. And very few patients are cured, and survival has been shortened. But what you'll be hearing over the next few weeks is of a new drug that's come out that is based on the genetics of the cancer, where we can target a certain molecule and we can extend the life of pancreatic cancer patients. We probably won't cure them, but we can extend the life by a few months to maybe 1 to 2 years.
Well, 1 to 2 years is better than a few months.
It really is. It really is. And it gives you time with your family. It gives you time to get things in order. It's a devastating diagnosis, and I've treated patients who are young and old, and it's always tough.
Have you determined, the other thing is determining what things people do that causes it. Any idea?
Yeah.
I mean, I've seen some articles in the last few months that in pancreatic tumors, they found plastics. And, the right now the taboo thing is when you drink water out of plastics or you eat food that's in plastics, that the plastics rub off into your blood system.
So let me begin with the plastics. We don't know yet. There's a lot of data that suggests that when you ingest plastics, it gets trapped in your body. But we don't know if it's causing cancer. And certainly cancer rates in some cases are going down, and in other cases are going up. In the case of cancers of the GI tract, pancreas cancer, colon cancer, gastric cancer, rectal cancer, those numbers are going up, and especially in young people. I'm seeing so many people in their 20s with cancers that you only saw in people in their 50s or 60s. Could plastics have something to do with it? I don't know. But we do know the causes of other cancers. So one, some people have a family history of cancer, and that's about 10% of all cancers. There's another component. What about just smoking or UV light, or if you get exposed with radiation? Those cause a big chunk of other cancers. But probably the most common cause of cancer across the population is bad luck. And it's a mutation that happens in the gene as we age, and it's something we can't control. And so even though that there are causes to cancer, a lot of it's driven by bad luck.
Well, it's good to say that, but I always think that you do something to your body, or you don't give it the nutrients it needs to build up the immune system. And that's just my personal opinion. And me, yeah. I'm just a grocery man.
But you know food, and you know how to nourish people, right? And I don't think you're wrong. I think in the future, we're going to understand that even if you have the bad luck of a cancer being born in your body, that because your body, maybe with a little help with nutrition, maybe with a little help of a medication, will be able to clear that cancer before it becomes a problem.
In addition, what we're doing right now, I have not, one of our companies, Gristides and D'Agostino, I have not run that company in 10 years or 15 years, but I am trying to tell our listeners and our customers to be healthier. One product that was a surprise, my mother and father always cooked it, okra. According to some science results, if you eat okra, the okra removes plastics from your blood system. Have you heard that at all?
I haven't heard it, but let me look something up really quickly as we talk. I think okra has a lot of fiber there. And we know that diets that are very high in fiber can clean out the GI tract. So there might be some truth to that. One thing that Americans don't eat enough of, and we do need to eat more of, is fiber. And okra may be a good source of that.
Well, Dr. Diaz, thank you so much, and thank you for everything you do to help people. And we hope to talk to you again in the near future. Thank you so much.
Thanks so much, and thanks for inviting me.